Welcome to the deep dive. Today, we're tackling something that feels, well, increasingly present in our modern lives: loneliness.
Hmm.
We've gathered a really interesting mix of perspectives to unpack this. We've got a preprint article from Sigan Kahinde looking at the broad impact, a detailed report from Harvard's Making Caring Common project with some, frankly, surprising data,
Yeah, definitely surprising in part.
and also some really thought-provoking angles from Medita.
Right. And our aim here, is to really dig into the nuances. Loneliness, it's not just about being alone, is it?
Not at all.
We want to explore the complex web of factors, who's actually feeling it most, which, like you said, might surprise you, and importantly, what potential ways forward are being talked about.
And just to kind of frame how significant this is, I mean, the U.S. Surgeon General has declared loneliness a major public health concern.
That's huge.
And Medita points out its impact on health is being compared to smoking 15 cigarettes a day.
Wow. Okay. That's
Aye.
that's quite a statement.
It really is.
Yeah.
So, okay, with that stark framing, where do we even start trying to understand this?
Well, I think first we need a common definition, right? What is loneliness? The Surgeon General's definition, which the Harvard report uses, calls it a subjective, distressing experience that results from perceived isolation or inadequate, meaningful connections,
Okay, subjective and distressing.
where inadequate refers to the discrepancy or unmet need between an individual's preferred and actual experience.
So it's that feeling of disconnect. It doesn't matter how many people are technically around you.
Exactly.
The Harvard report gives this powerful example, like someone surrounded by family but still feeling unseen, maybe unappreciated. It's about the quality of the connection, not just the number of people.
Precisely, that sense of being truly understood, valued. And they also talk about something called existential loneliness.
Existential loneliness. What's that?
It's this deeper feeling, like being fundamentally separate, almost like you can't really share your true self with anyone.
Mm.
And what's really striking is their research found that 65%, a big majority of people feeling lonely, reported that specific kind of fundamental separateness.
Wow, 65%. That really speaks to the depth of this feeling. It's clearly not just about, needing someone to hang out with on a Friday night.
Absolutely not. It's much deeper.
Okay, so it's not just physical isolation. Now, thinking about who this affects, I think a lot of us have assumptions, maybe older people. But the Harvard report, it threw up some really unexpected findings here.
Yeah, this is where the data really challenges those common ideas. The Harvard study found the highest rates of loneliness, 29%, were actually reported by adults aged 30 to 44.
Really? 30 to 44, not older adults.
Nope, close behind were the 18 to 29-year-olds at 24%.
That completely flips what I would have guessed.
Yeah.
We often picture loneliness affecting seniors, maybe those who've lost partners or friends over time.
Exactly. But look at this. The lowest rates in the Harvard data were among those 65 and older, only 10%.
10%, that's significantly lower.
It really suggests the picture of loneliness today might be quite different from that traditional view. It makes you wonder, doesn't it? What's going on with those younger and middle-aged groups?
Yeah, like, is it the pressure of careers, raising kids maybe? Less time or energy for those deep connections?
Could be. It's a really interesting angle.
What about other factors? Like, did they see differences based on race or gender?
For the most part, no. Harvard didn't find big gaps between men and women or across most racial and ethnic groups they looked at,
Okay.
but there was one notable exception. Adults who identified with more than one racial identity, they reported a significantly higher rate of loneliness, 42%.
42%. That's a really significant difference. It suggests maybe the complexities of navigating different cultural identities could play a role in feeling isolated.
It certainly raises questions about belonging, societal structures, yeah.
What about money? Did income or education matter?
Income did seem to correlate. The Harvard data showed higher rates, 29%, among those earning less than $30,000 a year. Compare that to, say, 19% for those earning $50K to $100, and only 18% for those over $100. So, a clear link there.
But not education.
Interestingly, no. They didn't find notable differences based on education levels, so financial strain seems linked, but not necessarily how much schooling you've had.
Okay, so we've got a clearer, maybe more surprising picture of who is feeling lonely. Now, the big question, why? Why are these trends happening? Mudita really points a finger at our increasingly individualistic culture.
Yeah, that's a core theme in Mudita's analysis. They argue the strong emphasis on, individualism, especially in Western societies, can kind of accidentally create disconnection.
How so?
While the pressure to be self-sufficient, to prioritize your own goals, can make it harder to ask for help or even just invest time in strong community bonds.
Right, like you're supposed to handle everything yourself.
Exactly. And this focus can even breed competition, social comparison, which ironically pushes us further apart. They also talk about the erosion of social capital.
Social capital,
Sure.
like trust and networks.
Yeah, basically the trust, the shared networks, the reciprocity that makes communities strong. When the focus is all on me, that can weaken.
It's like we're all pushed to be islands, but being an island isn't actually good for us.
That's a good way to put it. And the Harvard report also brings up digital technology, which Mudita mentions too.
Ah, yes, the tech factor always comes up.
It does. And while it connects us in, unprecedented ways, both sources suggest it's kind of a double-edged sword.
Mm.
The Harvard report found, get this, 73% of their respondents pointed to technology as a reason for loneliness.
73%, wow.
Yeah. The connections online, they can lack that depth, that sort of emotional weight of face-to-face interaction. Plus, as Mudita points out, you're constantly seeing everyone's highlight reels.
Right, the curated perfection makes you feel inadequate.
Exactly. And that always-on thing can blur work and life, lead to burnout, less time for actual, real-world relationships.
It's such a paradox, isn't it? The tools meant to connect us might actually be isolating us in some ways.
Precisely. Mudita also highlights shifting cultural norms. Think about it. Fewer traditional extended families living close by. More people moving for school or jobs.
Weaker ties to our original communities.
Right. And less civic engagement, less joining local groups. These faster, more transient lifestyles make it harder to put down deep roots.
And the Harvard report mentioned a really strong link with mental health challenges, too.
Yeah.
Like a vicious cycle.
A critical point, yeah.
Yeah.
They found a huge number. 81% of lonely adults also reported symptoms of anxiety or depression.
81%.
Compared to...
Compared to only 29% of those who weren't lonely, it really suggests this tough cycle. Loneliness can worsen mental health, and poor mental health can make it harder to connect.
That makes a lot of sense. When Harvard asked people directly, why do you feel lonely? What came up besides technology?
Well, tech was number one, as we said.
That's
But other big ones were not enough time with family. 66% said that.
okay.
Feeling overworked, too busy, just tired, 62%. Mental health hurting relationships, 60%. And that sense of an individualistic society we talked about, 58%. So a real mix of personal circumstances and broader societal feelings.
Yeah, and interestingly, about half also mentioned things like a decline in religious or spiritual life, or maybe focusing too much on their own feelings.
It really paints this picture of multiple pressures pushing people towards disconnection.
Okay, so given all this complexity, what can we actually do? What solutions are out there?
Well, both sources offer ideas, from individual actions up to bigger societal shifts. Harvard asked people what they thought could help on a personal level.
And what did they say?
There was strong agreement, like 75% or more, on things like proactively reaching out to family and friends,
Makes sense.
learning to, accept and love yourself, being more forgiving, and finding ways to help others.
Those feel like important personal tools, focusing on our own mindset, our immediate circle. But what about the bigger picture, systemic stuff?
Right, so the Harvard researchers really push for creating a culture that values care and service more.
A culture of care.
Yeah.
They talk about investing in social infrastructure. Things like accessible public spaces, parks, community centers, places designed for connection, and more community events. Apparently, 75% of people surveyed wanted more of that stuff locally.
So people actually want more opportunities to connect in their communities.
Seems so. They also suggest collective service like group volunteering as a way to build connections and find meaning and purpose together.
Okay. And Mudita, similar ideas.
Very similar. Mudita emphasizes actively building connections, volunteering, joining groups, community events, also, crucially, promoting mental well-being therapy, mindfulness, exercise.
Right, tackling that mental health link.
Yeah, and fostering supportive communities, like
Right.
through community gardens or shared workspaces, plus targeted programs for isolated groups like the elderly.
It's interesting how much overlap there is. This idea of both personal effort and building better community structures keeps coming up.
Absolutely. And that idea of civic engagement or volunteering pops up in both too good for the community and good for building your own connections and sense of purpose. Win-win.
And we need to remember, this isn't just about feeling sad, right? Mudita really hammers home the urgency because of the health impacts.
That's right. Mudita calls it a public health crisis. Serious negative effects on physical health, higher risk of heart disease, dementia, depression.
Wow.
And that shocking statistic, chronic loneliness potentially shortening lifespan by as much as 15 years.
15 years.
Mm,
Yeah, that's incredibly sobering. It really hits home how serious this is.
it really does. So tackling loneliness isn't just a nice to have for emotional well-being. It's fundamental to quality of life, maybe even longevity. And Mudid notes the pandemic really threw this into sharp relief, likely worsening things for many by isolation, job losses, stress.
Yeah, it amplified everything.
Yeah.
So, okay, wrapping this up.
Yeah.
The main takeaway seems to be loneliness is a huge, complex issue in our society today.
Multifaceted.
It affects maybe different people than we assume,
Yeah.
and its roots are deep culture, technology, mental health. They all play a part. But, and this is the hopeful part, there are things we can do, actionable steps, both for ourselves and as a society, to build more connection and push back against this isolation.
Exactly. Just recognizing how serious the consequences are is a start. And knowing we have agency, in our own lives and communities to strengthen ties, offer support. That's key.
So, maybe a final thought for you listening. Just take a moment this week. Think about the connections in your own life. Is there one small step you could take? Maybe deepen a relationship you already have, or perhaps reach out to someone you suspect might be feeling a bit cut off.
Yeah.
It really feels like tackling this loneliness epidemic has to be a collective thing, built one interaction, one connection at a time.